Hello students. Today we will discuss about the anatomy of posterior abdominal wall. Now when you will see the posterior abdominal wall, you know that in the posterior wall you are having the three major muscles. From medial to lateral, if you will go, you have the psoas major, then you will have quadratus lumborum and transversus abdominis. So today we will discuss one of those muscle, and that is psoas major. Now along the psoas major, sometimes you have a muscle which is known as psoas minor. So in today's lecture we will mainly discuss the detail about the psoas major muscle. Then we will have the part 2 of today's lecture, in which I will told you about the psoas fascia and the psoas abscess. So let's discuss about the psoas major muscle. So what is the introductory part? That it is a fusiform muscle, and this is placed on the side of the lumbar spine and along the brim of the pelvis. Now this is something is important, that when you will see the location of the psoas major, you will find that this is your lumbar spine, and along the lumbar spine on the sides you will find a fusiform muscle on both the side, and that is your psoas major muscle. But when you will trace the psoas major, you will find that it is actually running along the brim of pelvis. Now what do you mean by the brim? Now you will have a border which is known as medial border of the hip bone, and along this medial border, which is known as brim of the pelvis, you will find a muscle in the dissection, and that muscle is actually the psoas major. The another important thing is, which is very commonly asked question in your exam, that psoas major muscle is actually shared in three regions. Now it is present in the lower part of the thorax, that we'll see when you will have the medial arcuate ligament of the diaphragm. You will find that behind that diaphragm the psoas major is present. Then it is also present in the posterior abdominal wall, and the third thing is that it enters into the anterior compartment of the thigh, where you will see the floor of femoral triangle. You have this word psoas major. So my dear students, now the question is that which three regions are actually shared by this psoas major? So here in this image you can see that this is your medial arcuate ligament, and just below this medial arcuate ligament you are having the muscle, and this muscle is having a small entry into the posterior mediastinum of your thorax. Now here you can see it is present in the posterior wall of the abdomen, and here below the inguinal ligament, now it enters into the front of thigh. Then the psoas major and minor are most medially placed in the posterior abdominal wall, which I already told you that you are having three muscles: psoas major, quadratus lumborum and transversus abdominis. So psoas muscle is the most medial muscle. Then laterally it is having the muscle is known as quadratus lumborum. Now in this image you can appreciate very well that there is a medial arcuate ligament, then you will have the lateral arcuate ligament, and you will see that if you will divide these two ligaments in this way, you will find that medially you are having the muscle, and this muscle is your psoas major. So this is the question of your exam, that psoas major muscle is having the three region involvement: posterior mediastinum, abdomen and front of thigh. But my dear student, you have to keep this thing in mind, that in posterior mediastinum it is having hardly 1 or 2 centimeter extension, which I told you. Now the bony framework of the posterior abdominal wall. So when you will see the posterior abdominal wall, you will have the lumbar spine in the center, and you will have the two floating rib above and iliac crest below. Between this area you don't have any bone. This part is purely made up of the muscles. And what are the structures which are filling this gap below the rib above the iliac crest? So medially in this gap you will find the psoas major and minor. So here you can see that in this gap you will have these two muscles, or you can say the psoas muscles. Then if you will see laterally, this gap is having one more muscle. Now this is your quadratus lumborum. Then if you will go on the inferior side, you are having the muscle is known as iliacus. So this is your iliacus muscle which is present here. And when you will see the superiorly, you will have the diaphragm which is arising from the adjacent arcuate ligaments. So in this way, you will find that this gap between the 12th rib and iliac crest is filled by the muscles only, and these are psoas major, quadratus lumborum. In the lower part, you have iliacus and the diaphragm above. Now in this video, if you will see the orientation of posterior abdominal wall, you have to first understand that this is your psoas major muscle. And this psoas major is present on the posterior abdominal wall, and along with that you are having the one more muscle adjacent to this is your quadratus lumborum, and then this is transverse fibers of transverse abdominis. Now here on the opposite side, we have removed the psoas major. If you will ask me, sir, we are able to appreciate the transverse processes of the lumbar vertebrae. Why? The answer is because we have removed the psoas major. That means the psoas major lies on the anterior aspect of your transverse processes, and it also take origin not only from the body but also from the transverse processes of lumbar vertebrae. So now if you will see this video, you will see that there are muscles which are present in the posterior wall on both the side of lumbar spine. So here, if you will rotate and you will go posteriorly, you will find that posteriorly on the area between the 12th rib and iliac crest, you are not having any bone on these side. It is purely made up of the muscle, and the psoas major will come here to fill these gap between the transverse processes, which is not on this side. So this is the important thing to understand, that when you will rotate this posterior abdominal wall all around, you will find that the posterior wall is having the contribution of psoas major, quadratus lumborum. Clear? Now, the psoas major muscle covers the anterolateral surface of the bodies of the lumbar vertebrae. So this is the first thing which you have to understand, that it is covering the anterior and lateral surface of the body of lumbar vertebra. Now here you can see in this diagram that this is your lumbar vertebrae. Now when you will trace the lumbar vertebrae, this is your anterior surface of the lumbar vertebrae, and along with that you will have the lateral surface of lumbar vertebrae. So this area is actually occupied by the muscle is known as psoas major. And I already told you that just lateral to the psoas major, this muscle has to be your quadratus lumborum. So this has to be the quadratus lumborum. So this is the one thing which you have to understand. And second thing is that it filling the space between the vertebral bodies and the transverse processes, which we just appreciate in the video clip. Now what is the origin of psoas major? Now my dear friends, this is very commonly asked question in your exam. Origin of psoas major. Now you have to understand that its origin is from the posterior side of your abdomen, from anterior side of the vertebral column. It is a muscle which is taking origin from anterior aspect of vertebral column, not from the posterior side. Clear? So when you will see the anterior aspect of the vertebral column, first you are able to understand that you are find the bodies of your vertebrae. So when you will see the origin is mainly from the lower border of T12 to L5 vertebrae. Now which part of the vertebrae? Now this is the question. So first is the bodies. Now the bodies of the 12th thoracic vertebrae and all the 5 lumbar vertebrae, and the origin from the bodies are in the form of the 5 slips and 4 arches. So this is what I will explain what is the meaning of this thing. Second thing is that the origin is not only from the bodies but also from the intervertebral disc, which is between the T12 to L5, and lastly from the transverse processes of the lumbar vertebrae. So there are 3 areas of the vertebral column which is giving origin to the psoas muscle. First is the vertebral body, second is intervertebral disc, and third thing transverse process. Now my dear friends, you cannot forget this word. What is that word? Intervertebral disc. Why? Because if you will see, the most common applied aspect of the psoas major muscle is the psoas abscess, and 90% time the psoas abscess is the source is tuberculosis, and tuberculosis generally affect the intervertebral disc, and the infection of this disc is going to enter into the muscle that will accumulate into the lower part of the muscle, and this is known as psoas abscess. So this is very typical, or I should say the unique feature of the origin in this muscle, that because of the involvement of the origin of the disc, it is having the psoas abscess. So there are three areas. Now in this diagram, if you will appreciate these three areas, so first is that this is the vertebral body. Second is your intervertebral disc. So here you can see that this is your intervertebral disc, which is giving the origin of these fibers which are arising from the disc. And the third thing is the transverse process. So these are the transverse process which has to be present here on the posterior side, and these are not visible because muscle lies on the anterolateral aspect of the vertebral column. Now here you can appreciate the arches. Now where is the arch? Now this is the one arch, this is the second arch, third arch and fourth arch. So how many arches are there? There are total 4 arches. So this is the 1, 2, 3 and 4. Now how many slips? Now if you will see the slip, now this is the first slip, this is the second slip, this is the third slip, then you will have 4th slip and 5th slip. So there are 4 tendinous arch and 5 slips. Now in this image, if you will see the more enlarged view of the origin, you will find that the slips are arising from the 3 places. Now one slip is attaching at the 3 place. What these 3 place? 2 adjacent vertebral bodies and 1 intervertebral disc. Now if you will see in this image, you can find that this is an enlarged view. So you can see that this is the one vertebral body and this is the another vertebral body, and in between them you will have the disc. Now from all these 3 sides you are having the origin of one slip. So this is forming the one slip. In the same way you will have the one more slip, then you will have one more slip, then you will have one more slip here and one slip is here. So there are 1, 2, 3, 4, 5 slips, and these slips are connected with each other with the help of these arch which are known as tendinous arch. So what is the origin of psoas major? From the 5 slips and from the arches. Now what is the slip? Slip is a part of the muscle which is arising from the intervertebral disc and the 2 adjacent vertebral bodies. Clear? And this origin you cannot forget, because when the infection will arise in these vertebral bodies, it will enter into the from the disc into the muscle. Clear? So this is what you have to understand. Now this is the posterior view. Now this is the anterior view. Now from the posterior view you will find that the muscle is arising from this arrow area which is on the anterior aspect of these adjacent transverse process. The muscle is not present on the posterior side. Clear? Now what is the insertion of psoas major? If I will tell you in one line, you all know the insertion is on the lesser trochanter, and when you will have the insertion, it is a tendon which join with the tendon of the iliacus to form the conjoint iliopsoas tendon, and this iliopsoas tendon insert on the lesser trochanter of the femur. So when you are writing the insertion, you have to understand the course of the muscle. So first the muscle run along the margin of the pelvic brim. So when it will go downward, this is the pelvic brim which you can appreciate here, that this is the pelvic brim. Now this is the medial border of the hip bone. Now this muscle is present along the pelvic brim. So you will find the muscle is here which is overlapping the brim. Then you can see that this is the inguinal ligament. So the muscle will pass below the gap of inguinal ligament. So this is the important thing, that it passes posterior to the inguinal ligament and then it enters into the front of thigh. And when you will see the front of thigh, you are having the femoral triangle, and in the femoral triangle, you have the floor where you are having the iliacus and psoas major. But the important thing to understand that iliacus muscle is joining the psoas major on its lateral side, So this is the important thing, that it joins the iliacus on its lateral side, and ultimately the both will form the common tendon which insert on the lesser trochanter of femur. Clear? Now, what is the nerve supply? So whenever you are reading any of the skeletal muscle in the body, we always talk about the 4 more common asked question: origin, insertion, nerve supply, and action. So we have seen the origin of psoas major. Origin of psoas major is from the lumbar spine basically, and that is in the form of the 5 slips and the 4 tendinous arches. What is the insertion? It is insert in the thigh, that is on the lesser trochanter of the femur. What is the nerve supply? Now, nerve supply is by the anterior primary rami or anterior rami of L1 to L3 spinal nerves. Now, some book says L2 to L3, some book says L1 to L3, and some will have very rare supply by L4. So, the most common nerve supply from the lumbar plexus is directly from the L1 to L3 anterior rami. Now, what is the action of this muscle? Now, when you will talk about the action of the muscle, this muscle acts from both the end. That means it acts from the upper end and it also acts on the lower end. Now, if I will fix the lower end, then what will happen? That if the lower end will fix, this muscle will contract, then it will pull the body forward. But if the upper end is fixed and the lower end is pulled by, then you will have the thigh is moving upward. So, the both side it will work. So, if suppose the lower end is insertion, upper end is origin, then you will have the flexion of your thigh. So, this is the one thing. Second thing is that if the lower ends are fixed and upper end is moving, then it will bend you forward. So, this is one of the muscle which act from its both ends. So, this is a very commonly asked question, name the muscles which acts from their both ends. Now, this is something is very common action which we see. Now, suppose you are lying in the bed and you are in the supine posture. Now, when you will lift your trunk from supine to sitting posture, then what will happen? That this muscle is pulling your trunk forward. That means now its lower end or the femoral attachment is fixed and its lumbar attachment is moving. So, what is the action? Bending forward, or you can say you are lifting your trunk from supine to sitting posture. So, raising the trunk from the supine to sitting posture, and this posture, this movement is taking place against the gravity if you are in the bed. The second thing is flexion of the thigh. Now, flexion of the thigh is a very common or most important action, because if you are seeing the walking cycle, now suppose I have to start my walking, the first movement take place at the thigh. So, as soon as you will lift your limb to go forward, what will you realize? That there is always first flexion at the thigh followed by the remaining movement of the walking cycle. So, it is also the most important muscle which initiate your walking cycle, and that is by the flexion at the thigh. So, flexion at the thigh is also important. But again, you have to understand that flexion of the thigh is possible because now your trunk is fixed. So, your upper end is not moving, but your femoral end is moving and you are pulling the thigh in upward direction. Clear? So, for the flexion of the thigh at hip joint, you need to fix your trunk. Now, the third action is the lateral flexion. So, if there is a unilateral contraction, it is helpful in the other muscles of the abdomen in lateral bending. Then you will have the action to maintain the stability when you are walking, and it is a very weak medial rotator of the lower limb at hip joint when your foot is on the ground. Now, dear students, you have to understand that this is a very commonly asked question. There are two questions here, that one is about the fracture of the femur and one is about when the foot is on the ground. Now what does it mean? Now you are standing on the ground and at that time your both limbs are touching the ground. Now in this condition, this muscle when contract, it is responsible for the inner rotation of your lower limb. So when what will happen, there is a fixation of your foot, the foot is fixed and this muscle is contracting, it is responsible for the inner movement of your thigh. But suppose there is a fracture neck femur. Now if the fracture neck femur occurs, or I should say your limb is off the ground. Now when your limb is off the ground, this muscle is responsible for a small lateral rotation of the foot. At the same time, if you will assuming that there is a fracture neck femur, this situation is similar to the limb off the ground. Now in this condition, this patient comes to us with lateral rotated limb and toes are facing outward. And this is the question of your exam, that in fracture of neck femur, why the lower limb rotates laterally. The only answer is that muscle which are acting on this distal segment, because now the action at the hip joint is not possible because there is a discontinuation of the head and the neck. So now the movement at hip joint is not at all possible. It is the remaining distal limb which rotates laterally and it is caused by the iliopsoas. So iliopsoas are responsible to took your fractured distal segment of lower limb in lateral direction. So this is very commonly asked question, that when the neck of the femur broken, the psoas and iliacus rotates the distal segment, that means the remaining lower part of your lower limb laterally, and the toes are characteristically faced laterally. So this is very commonly asked question in your clinical side, that if a person is having fracture neck femur, why the limb rotate laterally? Because you cannot say now that action at hip joint. Why not hip joint? Because once the fracture has been there, the continuity between the head and the neck is not there. So the movement is not taking at hip joint. Clear? It is the distal fragment which is now laterally facing, or the rotation of the lateral side is happening because of this contraction of iliopsoas. Now we will see the action. Now this is the first action, and that action is the flexion at hip joint. So you can see that the muscle is pulling and your femur is going forward. So this is known as flexion at hip joint. Then there is a second action which I already told you is the lateral flexion, because of the unilateral contraction of your psoas major. So when you have unilateral contraction, you will have the lateral bending. Then you will have the third action when you are having the bilateral contraction. Now this action is in the two part. If you are standing, then it is responsible for the bending. But if you are in the supine posture, then it brings your supine to the sitting posture, and that time it is acting as an anti-gravity muscle. Clear? So this is sometime you have the question that which is the anti-gravity muscle. In standing position, it is not anti-gravity because you are going in the direction of gravity. But yes, if you are in supine position, then it has to be work as an anti-gravity muscle. Now, what are the relations of the psoas major muscle with lumbar plexus? Now, this is something is very commonly asked question, and you have to understand that lumbar plexus is formed on the lateral side of your lumbar spine, but on the same time you will find that the psoas major muscle is arising from the same area. So what will happen, because of the origin of the psoas muscle, the fibers of the lumbar plexus enters inside the substances of psoas muscle. That means if you are seeing any nerve of lumbar plexus coming out, it has to emerge from different surfaces of psoas muscle. So this is very easy to understand that if any nerve is coming out from the psoas major muscle, and if I will dissect the substances of the psoas major, if I will remove the fibers of the psoas muscle, I will find that this muscle is coming out after piercing the muscle, because the muscle is actually arising all around the exit of your lumbar plexus. Clear? So these are the few important nerves which relations are very important, which you can see in this diagram also, that anterior surface of the psoas major you have genitofemoral nerve which will come out from the piercing of the anterior surface. Medial surface of the psoas major is pierced by obturator nerve, and laterally you are having from above downward there are three muscles. One is iliohypogastric, ilioinguinal, femoral nerve and lateral cutaneous nerve of thigh. So this is very important question, and this is a question of your exam. Now in this image on this side you can see that this is your psoas muscle, and on the anterior surface if I am having this image based question, and if I will draw a line on the anterior surface of your psoas major and I ask name this red color line, answer is genitofemoral nerve. So that you can appreciate more clearly in these enlarged views. Now here you can appreciate that this is your genitofemoral nerve which is present on the anterior surface. Now apart from that, if you will see the lateral side, these are the nerves which are coming out. This is iliohypogastric, this is ilioinguinal which is going towards the inguinal canal, this is lateral cutaneous nerve of the thigh. Then on the medial side you are having this obturator nerve. So obturator nerve is more visible here, where you can see that this is the medial border of the psoas, and on the medial border you will find this nerve, and this nerve is obturator nerve. Clear? So this is some important questions which you have to understand. Now what are the relations of the psoas major muscles? So apart from these nerves, I already told you that psoas major is present in the three areas. Above the diaphragm it will enter into the posterior mediastinum, then up to the inguinal ligament you will find it into the posterior abdominal wall, and below the inguinal ligament you will find this nerve into the thigh. So you will find the relation in all the three areas. So first is in the posterior mediastinum. Now in the posterior mediastinum you will find that it enters behind this medial arcuate ligament inside the posterior mediastinum. So where you will find the pleura and but obviously the anteriorly you will have the diaphragm. Now what are the relations in the abdomen? These are the more commonly asked questions. Now when you will see this transverse section of the abdomen, this is your lumbar vertebrae. Now if you will see the muscle is present on both the side of this vertebrae. This is here on one side and this is here on another side. Now this psoas major muscle is divided into the different surfaces. First is the anterolateral surface of the psoas major. So where is the anterolateral surface of the psoas major? This is the anterior surface of the psoas, and this is the lateral surface of the psoas. So this is become anterolateral surface of the psoas major. Then you will have the posterior surface of the psoas major relation. So this is the posterior surface of the psoas major relation. Then you will have the medial surface of the psoas major relation. So this is your medial surface of psoas major, which is actually touching your lumbar spine. And the fourth is anterior margin. Now where is the anterior margin? Now this is your anterior margin. Now this junction of two surfaces is known as anterior margin of psoas major. So in this diagram, if you will see the anterior margin, this anterior margin is actually run along parallel side where you are having the origin from the slips and tendinous arch. Clear? So you will divide the abdominal relation in four parts. One is the relation on the anterior and lateral surface of psoas major, posterior surface of psoas major, medial surface of psoas major, and this border of the psoas major. So what are the relations on anterolateral surface of psoas major? So when you will see the anterolateral surface, the first thing you are able to understand that anterolateral surface is in upper part covered by a arch of diaphragm, which is known as medial arcuate ligament. And when you will go in the lower part, you will see that the whole area of the posterior surface is covered by the peritoneum. So here you can see that this is the peritoneum, and this peritoneum is covering the anterolateral surface here also and here also. Clear? Then what are the other relations on the anterolateral surface? You will have the kidney, ureter, renal and gonadal vessels, genitofemoral nerve, psoas minor, inferior vena cava, terminal part of the ileum, colon on the left side. Now in this image, what you are able to understand now? Now you have seen the kidneys, and when you will read the posterior relation of the kidney, you are having the three muscles from medial to lateral: psoas major, quadratus lumborum, and transverse abdominis. So it very clear now that on the posterior side of the kidney, you are having the some portion of the your psoas major. So this is the psoas major muscle, and on the anterior surface of the psoas, you are having the kidney. And from the kidney, the ureter is going downward. Now, when you will trace the ureter, we always use the transverse process tips of lumbar spine for its course, because it runs on just near to the transverse process on anterior surface of psoas major, that I will show you in the coming slides. Apart from that, you have anteriorly genitofemoral nerve, which I just told you that it pierces the anterior surface to come out, and you have the psoas minor, which if sometime present, it runs on the anterior surface. Inferior vena cava and colon, you know that inferior vena cava is also present, but it is on the right side, it is having no relation on the left side. And the colon part is present only in the lower portion. And you have the sigmoid colon, which crosses the pelvic brim, so it comes in relation with the left side of your psoas major. Now, in this image, you can appreciate that this is what you have, the two muscles. One is your psoas major and one is the quadratus lumborum, and psoas major is passing behind this medial arcuate ligament. Now, here we have seen these, we have now having these two images. Now, this is actually showing again the important concept of the relation. Now, my dear students, you have to understand that this is your inferior vena cava, and this inferior vena cava lies on anterior side of your right psoas major. So, this concept is to be there in your mind, that inferior vena cava is not in relation with the left psoas major. And apart from that, you can see that both the side of the psoas is covered by the peritoneum. That means your psoas majors are retroperitoneal. Clear? Now, when you will see the kidney, you will have the posterior view, and this is your anterior view. Now, in this posterior view, whenever you are drawing the posterior relation of the kidney, you always draw the three surfaces. Now, this is the medial most surface, which is for psoas major, and from anterior side, when you will see, you will find that this lower pole lies on the psoas major. Now, the relation in the abdomen on posterior surface of the psoas major. Now, if you will see the posterior surface of the psoas major, it is mainly lies on the transverse processes. So, these are the transverse processes of your lumbar spine, and this is your posterior surface of the psoas major. So, psoas major posteriorly supported by the anterior aspect of the transverse processes, and you have the lumbar plexus in the substances of psoas muscle. Now, what are the relations in the abdominal part on medial surface? Now, medially, when you will see the muscle, medially it is facing towards the body of your lumbar vertebra. So, medially it is related with the bodies of the lumbar vertebra and also with the vessels which are known as lumbar arteries. Now, here you can see in this diagram where is the lumbar arteries. So, these are the lumbar arteries which are the branches of your abdominal aorta. So, these lumbar arteries are running along or adjacent with your vertebral bodies, and they will come in contact with the medial side of the psoas major. Clear? Then you are having the relation in the abdomen on the anterior margin. So, I told you that in the abdominal part we see the relation at four places: anterolateral surface, posterior surface, medial surface, and the anterior margin. And this anterior margin is come in contact with the sympathetic chain. Now, this is something is important. In this image, you can see that there are sympathetic chain present on both the sides. You can see these are the sympathetic ganglia, and these ganglia are interconnected to each other by these sympathetic fibers. So, this is the sympathetic chain, and these chains are running along with the anterior border of psoas major muscle. Then you will have inferior vena cava on the right side, aorta overlap the margin of the left psoas, external iliac vessels which runs along the pelvic brim. So, you know that when you are talking about the terminal end of the aorta, that aorta will divide into the common iliac, and this common iliac will give the external iliac and internal iliac. So this external iliac will run here along the margin of pelvic brim where you have the medial border of psoas major muscle. Now what are the relations in the thigh? Now in the thigh, the relations are mainly, we are talking about femoral triangle. So in the femoral triangle, you are having the iliopsoas most laterally in the floor. So anteriorly, when you will see the femoral triangle, you will find the femoral artery and the fascia lata, which is known as deep fascia of the thigh. But posteriorly, if you will remove the muscles, you will find that posteriorly you will have the hip joint. So posteriorly you will have the hip joint. Now medially what you will have? Now medially, when you will see the floor of the femoral triangle here, you are having the four muscles: iliacus, psoas major, pectineus and adductor longus. That means the pectineus muscle comes here on the medial side of your iliopsoas tendon. So laterally you will have iliacus, medially you will have pectineus. And what are other thing you have laterally is femoral nerve. Now this is something is important, that when you will see the front of thigh, when you are dissecting, you will find that femoral nerve occupy the groove between the iliacus and psoas major. So this is the femoral nerve and it lies in this position. And femoral nerve comes from the lateral border of your psoas major, then it comes below the inguinal ligament and run in this gap between the iliacus and psoas major, but lateral to the psoas major. So what are the relations? On the lateral side, you will have femoral nerve and the iliacus. Medially, you will have pectineus. Posteriorly, you will have hip joint. Anteriorly, you will have femoral artery and fascia lata. Now, this is what I am asking about. Now, when you will see this type of the image, now this is your computed, your CT scan, and this CT scan is showing the 3D urogram. Now, in this 3D urogram, if you will have the ureter, you will find that this is your ureter. Now this ureter is lying in front of a muscle. Now where is the muscle? If you will trace the muscle, now this is your psoas major. Now on both the side you will find the shadow of the psoas major is very clearly visible. So this is very important to understand that ureters are lies on the anterior aspect of your psoas major muscle, and when you will see more specifically, you can see that this ureter is running just adjacent to the transverse processes of your lumbar vertebrae. Clear? So this is what about the psoas major. Now what about psoas minor? It is a very rare muscle. It may be absent. It is not a constant finding. Now if it is present, you have to again see for the origin, insertion, nerve supply and action. These are the four things which we always talk about any muscle. So it arises very high from T12 to L1 and their intervertebral disc. When you talk about the insertion, most of the time you have the question about the insertion of psoas minor. Then the answer is iliopubic eminence. The answer is iliopubic eminence and pecten pubis of the hip bone. What is the nerve supply? It is supplied by the spinal nerve L1. And what is the action? Because it is very weak muscle, so it causes very weak flexion of trunk. Now here you can see that where is the muscle? Now this is the psoas minor. Now this psoas minor will end at this point only, that is at iliopubic eminence, and this psoas minor is arising very high from T12 to L1, and this muscle lies on anterior aspect of the psoas major. Clear? So if you are having the question on psoas minor, you should keep this thing in mind that it lies always on anterior side of the major, and it is a very thin muscle which starts from T12 and at iliopubic eminence. It will never come out into the front of thigh, and this muscle supplied by L1 nerve. So this is at the end of this class of the psoas major. Now you are able to understand that what is the origin, insertion, nerve supply, action, and its origin from intervertebral disc is important because it is a cause of the spread of psoas abscess. And another important thing is about the action, that the psoas muscle is one of the muscle which act from its both the end. If it is acting on upper end, then it causes flexion of the thigh. If it is acting from its lower end, then it causes forward bending of the trunk. So this is all for today's class. Thank you.